While summer is a favorite time of year for many, for more than 16 million people in the United States who struggle with the skin condition known as rosacea, it can be a challenging time. The intense sun, hot weather, and increased physical activity can pose problems for those with the inflammatory skin condition. More than 82% of people feel that their rosacea is uncontrolled, but now the Food and Drug Administration has given a green light for a new treatment that has shown significant improvement in the bumps and blemishes of the condition. Joining me now to discuss it and more is Dr. Ted Lain, Executive Director at the Austin Institute for Clinical Research and the Principal Investigator of this latest treatment. Thank you so much for joining me today.
It's a pleasure. Thanks for having me.
Now, first, Doctor, can you describe what this disease is and how it affects people who have the condition?
Inflammatory skin disease that affects primarily adults starting at about the age of 30, with intermittent episodes of flushing or blushing of the midface, so redness on the midface. Over time, those intermittent episodes can become one long constant episode, so just persistent redness. It can be accompanied by bumps and blemishes, so small red bumps can start occurring. Over time, they can become larger, which can become tender, uncomfortable, and embarrassing. Rosacea isn't rare. It affects nearly people in the United States, which is about 5% of the population. So we all know someone who suffers from this common skin condition.
Yes, absolutely. Now, we know that warm weather is a trigger, and we know that we've been going through this heat wave for a couple of weeks now. Are there any other triggers for the condition that people should know about?
You're outside in the heat of the day is horrible for the rosacea patients. It causes their redness to worsen very quickly. In addition, unprotected sun exposure is another trigger for rosacea. So going outside without your SPF 30 broad spectrum sunscreen can cause your redness and pimples. Finally, there are some lifestyle choices that can worsen rosacea. So if you choose to eat spicy, that can cause the redness to get worse. And if you choose to drink alcohol, that can also cause the redness to get worse. I'm in Texas. We love our chips and salsa and our margaritas, but unfortunately, all of that can worsen rosacea. So it's tough for these patients to really dial back what they enjoy in order to control skin disease.
That's great information to know, and thank you for sharing that information, because especially now that new products and beverages are coming on the market, these are things that people need to know who have this condition. So thank you for sharing that information. Now, what else can you tell us about this latest development in the treatment?
Over 80% of patient condition is uncontrolled, so there is certainly opportunity to epsilate cream to the market. Epsilate the blemishes of rosacea. I was a principal investigator on the clinical trials who were using this new cream once daily. 40% after 2 weeks of use. After 12 weeks of use, almost 70% of the bumps gone, so the really good efficacy. In addition, this new cream was used for 52 weeks as a safety trial to assess whether any side effects did occur, and if they did, they were almost all mild in severity. They included redness, itching, burning, swelling of the face, and in very rare conditions, they can include anaphylaxis. Important for patients with rosacea who are seeking new therapy to speak with their doctor or their dermatologist to determine what.
Yes, for sure. Now, we know that there have been other treatments in the past for rosacea. Tell us about some of the issues that people have experienced with those treatments and how this new treatment differs and is a much better alternative than those treatments prior.
Absolutely. Look, with the historical treatments, less than 50% of patients are satisfied. They don't feel like it's controlling their results. I think what's important to know about this new treatment is that it includes microencapsulated benzoyl peroxide. And what that allows is for the benzoyl peroxide to be slowly released onto the skin. So we're not having a huge amount of active ingredient hitting the skin all at one time. That's important because people with rosacea have sensitive skin. So we have to limit what their skin comes in contact with. And that's what this new microencapsulation technology does. We see that it has great tolerability, which is usually something that we don't see with rosacea because there's almost always a trade-off between tolerability and efficacy that we just don't see with this new treatment option.
For sure. And for those who suffer with the condition, how should they go about getting that discussion started with their dermatologist or their skin specialist about this new treatment and options to get it available for them to start using?
Well, if you suffer along with bumps or blemishes, this may be a good treatment for you. I'm your physician or dermatologist to discuss it. You can learn more about both rosacea and this novel treatment option at epsolay.com. That's EPSOLAY.com. And as I tell all my patients and my children, power. So learning more about the condition will allow you to determine, along with your dermatologist.
It sure will, and you're absolutely right. Thank you so much for everything you've shared today to enlighten people, especially as we go through this heat wave for sure. And just want to let everyone know for more information about the new treatment as well as other tips and advice to keep yourself safe during the summer and keep your rosacea from inflammation and causing up. You want to visit epsolay.com, EPSOLAY.com for more information, and also start that conversation with your dermatologist or skin specialist. Ask them about this new treatment, see if it's right for you. Thank you so much for joining me today, Dr. Lain. It's been a pleasure. Thank you for sharing this important information.
Oh, thank you for having me.
Have a wonderful day.